waste that you're generating, but it's also indicative of the amount of materials that are going in. And in this chart, we're looking at just the amount of waste that is coming out of these different places. And basically, if you see that total, 30 pounds of garbage of different types per day per patient in conventional and palliative care, compared to half that amount in hospice. So there's still a lot. The average per person in their own home is about 6 to 7 pounds of garbage per day that we're creating, including recycling. So it's double the amount that you would be generating if you were just sitting around at home. So there's a lot of waste coming out of these places. Infectious waste, obviously much higher in conventional and palliative care, because you have a lot more surgeries and things like that going on in the hospital. Pharmaceutical use, much higher in conventional care, over double the amount of medications that are being used. Yes?
Yeah, I got a couple questions building. So in the conventional hospice care, how is that decision, where is that decision happening? That's the patients deciding?
For
choosing which they're going to be in, the conventional, in the palliative, in the hospice.
That's the biggest governance factor that I found. The patient can ask for palliative care, but they don't know about it, or they don't know what it can do for them. Yes?
Because quite a few slides ago when you were talking about some of the costs, but what came up to my mind was when they were having the big healthcare debate, was, especially with Medicare, they were all convinced that the U.S. government was going to put in death panels, and that's because you are saving so much money. And where does that decision process get made? Is it trying to change the behavior of patients so that they want to choose hospice, which I think actually, like if I look at my grandmothers, I don't think either one of them would ever want to be in a conventional hospital hooked up to tubes. They just want to